As we end this year in Washington, the past 12 months offer us a window into who we are and where this nation and its leaders might go in 2021. The year began with a deadly pandemic that upended our healthcare system and economy. Then in May, the brutal killing of George Floyd in broad daylight sparked outrage and nationwide protests against racism and police brutality. And in November, the Biden-Harris ticket won the election. But President Trump keeps fighting and refuses to concede. Joining us tonight to discuss the Washington year in review are three reporters who covered it all. Weijia Jiang, White House correspondent for CBS News, Errin Haines, editor-at-large for the 19th, and Balz, chief correspondent for the Washington Post. Let's begin with the lessons from January and February, when health officials grew increasingly alarmed about the outbreak of a highly infectious novel coronavirus in China. President Trump's response quickly became one of the biggest stories of the year.
China closed off Wuhan, a city of 11 million people, in an unprecedented effort to contain a deadly virus.
Health officials in Washington state reported the first death from the novel coronavirus in the United States today.
Today, I am officially declaring a national emergency. Two very big words.
We're appealing to all Americans to take these steps to protect each other and to ensure that the virus doesn't spread.
Yesterday, New York saw the highest number of deaths yet in a single day.
I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that?
A dozen states across the South and Southwest reported record increases this past week.
If we didn't do testing, we'd have no cases.
We may see a surge upon a surge.
A grim reality. COVID kills more in the U.S. in a single day than ever before, as infections and hospitalizations continue to skyrocket.
And I know times are tough, but I want you to know that help is on the way.
By late December, more than 300,000 Americans have died. Dan, when you look back on the pandemic and Washington's response, do you see a collision of politics and science?
Yes, remarkably so, Bob. I mean, this should not have happened in the way that it did. But tragically, this whole pandemic has become highly politicized, and I think much of that lays at the doorstep of President Trump because of the way he did or did not handle it throughout the year. He was often at odds, almost regularly at odds, with the scientists and the health officials in his own administration and outside the administration. He sent mixed signals. He pushed against the advice of many of the experts and has created an environment in which people have taken sides over whether they should wear masks or social distance. And unfortunately, more than 300,000 people have paid with their lives as a result of this, and we're still deep in the middle of it, even though there is some hope on the horizon as the vaccine has begun to arrive and people are able to get it. But this has been a terrible year, and as I say, much of it lays at the doorstep of the president.
Weijia, you're on the White House beat. Has President Trump's engagement with the pandemic changed in any way since the beginning of 2020?
Bob, I think one thing that is remarkable is that it hasn't. And in some ways, the beginning of the pandemic is ending in the same way under the Trump presidency because his message has not matched the moment in the beginning and even now. As you rightfully pointed out, the president was always resistant to communicating the severity of this virus because he was leaning in to his inclination to be a leader that offered hope, that remained positive, but that did not match the science. And even now, I think he had a real missed opportunity to end his presidency on a high note with the rollout of a vaccine for the American public. And even now, he's not meeting the moment because he is not out here being the face of the vaccine and urging his supporters, who we know are hesitant to get it, to do so when it's available to them. So, we've seen this from President Trump from day one, and he has been consistent in wanting to downplay how serious this virus is.
Errin, how do you believe President-elect Biden and Vice President-elect Harris will handle the pandemic in their first 100 days?
Well, Bob, if the way that they campaigned and these early days during the transition are any indication, they planned to set the example and to lead from the top to show Americans where they stand on confronting this pandemic and how they hope that Americans will behave as we try to get to the other side of what has been a very, very grim period in our country's history. Listen, during the campaign, you saw them social distancing, wearing masks, holding campaign events, in a socially distanced and responsible way, even as President Trump was holding, rallies where his supporters, at least some number of them were getting sick, holding events at the White House where people were getting sick, where dozens of people in the president's orbit have become sick, where the president himself became sick just before the election. And then to see President-elect Biden taking the vaccine just this week, to see Dr. Fauci, who is going to be, part of the Biden-Harris administration, taking the Moderna vaccine. We know that Vice President-elect Harris, a Black woman, taking this vaccine, the optics of that could be very powerful in a community that is also skeptical and rightfully so because of the history of race and medicine in this country. The message that will send in ensuring, confidence and trust in taking this vaccine and encouraging Americans to really participate in what is going to hopefully be our new normal. Listen, at the beginning of this spring, the mantra was that we're all in this together. That was an open question that I think didn't really bear out this year. And I think that for the Biden-Harris administration, that is a message that they will try to pick back up as they take office.